Earlier, we met Dr. Vic Strecher, who founded the Center for Health Communications Research at the University of Michigan. Early in Vic's career, things were going well. He had graduated from the University of Michigan, was on a tenure track at the University of North Carolina, and was having success attracting research grants. But he was frustrated by the limited reach of his work. Then something happened that changed the course of his life. While on sabbatical in the Netherlands with his family, a virus attacked the heart of his 6-month-old daughter, Julia. The Strechers were told that Julia had no more than 30 days to live. Distraught, they returned to North Carolina, where doctors said the only hope was to attempt a procedure that hadn't yet been performed at UNC's hospital: a heart transplant.
The biggest decision we had was whether to even do something like this. We didn't want to make our child suffer anymore. So I went to the medical library for many nights in a row, studying whether to do this or not. And I remember one night my dad turned to me and he said, "You know, you're pretty lucky, Vic." And I said, "Why am I lucky right now? I don't feel lucky." This is at about 1 in the morning. And he said, "You're lucky because most of the information in the world is at your fingertips, on computers, in software, from medical journals, and you can pull it all together and assimilate it and make a better decision. Don't you do that for a living?" You know, he said, basically, you know, why don't you do this for the world? I started thinking about my own mission in my life and my own career and asking myself, is this something that I really want to be doing for the rest of my life? Publishing articles, getting grants, and hoping, just hoping that other people take the results of my research and turn it into something real. Julia did live to be 19 years old. She died 2 months ago, unfortunately, but I feel like we were given a gift. We have a gift of Julia of 19 years, and she is very special. She changed my life, she changed our family's life, and she created this company.
The company that Julia inspired and Vic launched is HealthMedia.
So I really think that we need a bigger program in the disease management area.
Dr. Strecher's foray into the commercial realm gives people outside the academic world a chance to work with one of the big names in health behavior research.
I've been in this space of helping to manage health for different populations now for about 18 years. And he's one of those names out there that you hear where he's kind of an icon in our industry. You always hear the name Strecher. And whenever things come up around behavior change or tailoring personal communications, there's always that name, Strecher.
What are some of the mobile technologies you think might be relevant to a person with diabetes, for example?
What about like feedback to the individual from a coaching perspective?
Yeah.
Whether they're, you know, somebody texts them a message, or maybe you're working with somebody who's maybe actually doing live coaching.
It's almost like having a coach on your shoulder, you know, whispering in your ear as you're going along.
Vic is a guy that fuels the innovation here at HealthMedia. Everybody gets it. Sure, I should eat better. Sure, I should stop smoking. Sure, I should do all those things. But that little nuance of how you make that happen is all the difference. And that's sort of where the science comes in and the art of how you deliver that science. And that's where Vic has been tremendous, because he's a thought leader. We've talked about things and have done things where a list of questions to ask your doctor could be sent to your mobile phone. That's a very practical, simple thing to do, which is great. But the kinds of things I think you're talking about take it to the whole next level.
HealthMedia employs 170 people and counting, and was recently acquired by Johnson & Johnson. It's easy to see now that it's a huge success. But according to Kenneth Warner, the dean of the University of Michigan's School of Public Health, bringing research to the marketplace was a risky proposition for an established researcher and academic.
I mean, I don't think you got a whole lot of academic plaudits for what you've accomplished.
For setting up HealthMedia, no.
Right.
No.
Was there pushback at this idea of making a commodity out of research?
Absolutely. He had colleagues at the school who were kind of looking down their noses at him for going in this direction. And it's tough. I mean, it creates a barrier to getting good ideas translated into practice. And your case is such a wonderful example of where if you had not taken this to the commercial sector, nobody would be using it.
Right.
It would just be sitting on the journals and the shelves along with all the rest of the academic output. There are appropriate occasions on which we should be using the marketplace to get our ideas out there, to get our products out there, to do some good.
And here's where it comes full circle. Vic risked his reputation in academia and research circles so his work could benefit more people through commercial application. And the accolades from the academic world came pouring in.
We add to that recognition by presenting Vic Strecher with his first ever UMSPH Award for Excellence in Translating Research into Practice.
He's up there at a level way above what many of the rest of us here would ever hope to experience. This is a guy who could see the potential of the internet before the rest of us even knew what the internet was.
In addition to receiving this first ever award from the School of Public Health, Dr. Strecher was also singled out from the entire university for its Distinguished Innovator Award. Vic says the prize is shared by his many collaborators and the university itself.
It's the structure of the University of Michigan that's allowed me to innovate pretty quickly. It was the university that encouraged me to set up a business. It was the University of Michigan's Technology Transfer Office that brought in the venture capitalist for our company. Without the university, HealthMedia wouldn't have existed either.
This innovator sees even more changes and opportunities on the horizon.
I feel a tremendous sense of gratification to see that millions of people are using our programs and changing their behavior as a result. But my goal is to try to reach 1 billion people, to empower them, to help them make changes in their lives. That's great. That's all we wanted.